Hello everyone, my name is Dr. Rick Harrell. I'm an orthodontist and also the program director for the Georgia School of Orthodontics in Atlanta, Georgia. I wanted to reach out to you today to talk about a webinar that's going to be presented by the International Association of Dental Students. This webinar will be on Saturday, December 10th from 3 o'clock to approximately 5 o'clock p.m. Eastern Standard Time in the United States. I wanted to go over some of the topics we'll be covering at that webinar with you. So let's take a look at what's on the agenda for it. We're going to talk about in the first webinar, contemporary orthodontic treatment. This presentation is going to cover commonly executed orthodontic treatment procedures, and including in the presentation will be some of the following topics. First, we'll talk about some traditional non-extraction therapy. And secondly, we'll move into extraction therapy in a couple of different realms. The first will be early extractions and what we call driftodontics in the world of orthodontics. The second would be just traditional extraction therapy. Our third topic will be early orthodontic and orthopedic correction of skeletal malocclusions with our younger patients. We'll then proceed to combined orthodontic and orthognathic surgical procedures, which I think many of you will find somewhat fascinating. We'll also include in the lecture diode laser procedures. So I'll show you some of the commonly used soft tissue surgical procedures that we use in orthodontics. The next topic will be on temporary anchorage devices or mini screws, and I'll give you various applications of these mini screws in contemporary orthodontics. And finally, we'll talk about post-surgical management of impacted teeth, which again, I think will be a fascinating subject for you as dental students. So I hope to see you all on Saturday, December the 10th from 3 o'clock to 5 o'clock p.m. I think you'll find it to be an interesting talk, and you'll see how we can make things happen in the world of orthodontics. Thank you so much for your attention, and hopefully see you next week.